This is Priyanka Sarkar, and welcome to the Sport Soul, a space where we explore the real stories and emotions behind strength in sports and in life.
As people have been living longer, conversations about aging, cognitive health, and mental health have become common. But what we try to not talk about is dementia, which creates confusion, fear, anxiety, not just in people who are suffering from dementia, but also the families and caregivers. Today, we will be talking about what scares us about dementia, what are the signs that we can see when somebody is stepping into that phase of their life, and how we as families and caregivers can take care of them and ourselves, which is very important. Joining me on another episode is Ms. Thashreefa, a psychologist, and thank you for doing this with me again, Thashreefa. Thank you so much. Before I get started, I want to understand the basic meaning or definition of dementia, please.
In simple words, I can tell that dementia involves a group of symptoms that decline our cognitive capacities that we need for daily living.
Is dementia a part of aging, or is it a part of mental health decline?
It's not a part of aging. It's a myth that people think that dementia is a part of aging. So, if we go deep into dementia, dementia is just an umbrella term. So under dementia, there is Alzheimer's, there is vascular, which comes after stroke, and there is Lewy body dementia and frontotemporal dementia. So there are different kind of dementia in that only, but none of them is part of aging. Okay, I can give you a simple example. So like all our body part, even the brain will get tired when we are old. Like, our hands get tired, our feet get tired, and all the other organs get tired. Its brain also get tired. So there will be difficulty in remembering everything as such, like, in pure form. But in dementia, if I can give you a single example, is a person in their old age with normal aging difficulties will remember what a key is. Okay, what the key is used for, but sometimes they will forget where they put it.
Yeah.
Okay, but in dementia, they might not recognize what this is for, what the thing is. Sometimes they just put it in their mouth, so they will not be able to collect all the information regarding that.
So, are there any early signs that someone can detect dementia, or are there any risk factors?
Very common are repetitive questions. They will ask a questions, and then if you answer them, after some time they will ask the same questions. It's not like it will be a pointer for it, but we can check if everything okay with this person. And difficulty in recent memories. So dementia affect the short-term memory. Their long-term memory will be completely preserved to an extent, but their short-term memory is completely compromised. So there will be signs they will not be able to remember something, some events, some people. So just check on that also. We can do that also. And so sometimes they will get confused. So they will get confused the place they live right now. So for them, it will be their old house. So they will be like, I want to go to my old house. I want to go to my own house. So this might be their own home that they bought after some time, but their memory of house will be that only. So that confusion will be there. Sometimes they will go for their regular shopping. They will be grocery shopping. They will be going for temple, whatever, group of friends they meet. But when they come back, there will be confusion in the way. So they will get lost, might wander. So that could also be taken as a symptom, like in the first place. It can be, let's just check, like, if everything is okay, that could be done.
Can stroke lead to dementia?
Yes, sometimes. So there is a dementia called vascular dementia. It comes after stroke. Like usually vascular dementia happens when the oxygen supply to the brain get disrupted. Okay, and it could happen. It could lead to that. I think that are studies which says 30% can lead to dementia, and there are other studies which says higher versions can lead to dementia. So that could happen.
So may I ask, what does dementia do to the person affected and to the person who's giving care to the affected?
Okay. So primarily what happens is dementia affect the brain, the memory. Okay. And it also again depends on which part of the brain it affects. Like, we have different areas for different functions. So which area is affected, that also depends on that also. But primarily, what we always see is memory will be getting affected in that. So they will not be remembering somebody's name. So we will not be taking it very seriously because it happens, old age, it happens. We will take it in that note. Later stage, what happens, there will be behavioral changes. So there will be delusion of persecution that, people is trying to harm them, take everything away from them, delusion of infidelity, grandeur, and hallucinations. There will be visual hallucination, auditory hallucination. There will be disinhibition, There will be apathy, depression also, sleeping difficulty, appetite difficulty. So there is a lot of things that comes later after some time. Then people think like, okay, what is happening right now? But there are people who still think that, they are just doing it like that. So if any hallucination comes, they will, something is wrong with them. So they are not taking it seriously in the sense that there is some illness that actually make them do this. So that awareness is still unknown for many. So that could also be happening. Some behavioral changes can also happen. Cognitive changes also can happen.
Can dementia be prevented, Thashreefa?
I cannot say it can be prevented as such, but we can manage. There are a lot of factors, risk factor for dementia. Age is a risk factor, and genetics is a risk factor, and like the habits, not healthy habits, is a risk factor, and hearing loss can be a risk factor, and education, cognitive stimulation. So what happens mostly is our parents, they will be retired.
Yes.
And they will be like, oh, now I have to rest. Like, I have done everything in my life, I have to rest. So that is a big risk for it, because we need to stimulate our cognition. So it is very important to do something new every day. So we usually tell anybody to learn new language. So because they will be like, I am doing everything. So it's all automatic. So they will be driving. It's automatic for them. They will just get into the car and they know how to drive. So learning something new. So all this could be a thing that we can just measure. Okay, this can be done. So there is a risk factor. So some people have family genetics is there in dementia. So that could also be taken as a risk factor. So there are risk factors. So if we just follow up on that and make sure we are doing all the checkups and everything, so that could be a plus point where if something like that happens also, we can detect early and do whatever needed for the betterment.
How does dementia affect caregivers?
So in dementia, it will be a role reversal for the caregivers also. Okay. And what comes next is the behavioral problem. So they will be just taking off the clothes and walking around. They will be just accusing a person that they are doing something this to me. They are not doing actually, but this delusion and all those other behavioral changes are making them say that, they are doing this, they are sexually doing this to me and all those stuff. It is very difficult for the other family member to, they know that, it's because of their illness. But to an extent, it's very difficult for them to accept it like, my loved one is saying that I am doing something to them. So it's very difficult. So they will be more in distress and anxiety. So there is a chance that, a lot of people are having depression because of this caregiving burden, because that there will be a person whom they are very comfortable with, and this person cannot go anywhere. The person with dementia always need this person. So that again is like they're not having any break. At the same time, this person with dementia cannot communicate properly. So other people, normal old age people who are having any other difficulty, any other disease, they can tell, okay, I'm having pain here. Okay, I'm having this difficulty. I cannot eat. But a person with dementia cannot communicate their needs. So that again will be coming to any behavioral distress. So this person will not be able to understand what is happening right now with mother or father. So that again causes distress to them. So it's a lot of stressful events for them.
So I just want to ask you something. So dementia is not kind, not to the one who's suffering, and
Yes.
neither to the one who's giving care.
Yes.
So for the one who's already suffering,
Mhm.
a caregiver tries to understand what is not spoken, see what is not shown, and hear what is not spoken. You know, there are people who are always taking care of caregivers.
Mhm.
There are people who are already taking care of patients who are suffering with dementia
Mhm.
within their own capacities that human capacity can afford. These people are looking at those things that are unseen, taking care of everything for the for the patients. How does this change the identity of the caregivers themselves?
It's very difficult, we all know that. But the identity is, they will not have a self of their own. So that self dissolve in whoever they are caregiving for. So it's like they will always have to be there for them. They love their parents or whoever they are caring for, love very much, but that dissolvement in their caregiving makes a lot of difficulty for this caregiver, because they will not be able to go out on their own. Everybody need a break. Like, we love our parents, whoever is caring for whoever their loved ones, they love them very much, but a break is very important. They cannot take it. They will be having a profession, but they might have to quit that also. Financial burden also comes. So it's a mix of a lot of factors. Sometimes they will be bedridden, sometimes. So a major issue is fall. Dementia patients, if they fall and they just get bedridden, it's become very difficult for the caregiver again. So it's a lot of physical, psychological, financial burden. I would tell anybody who is taking care of a loved one, just take help. Like, whoever is available, just take help. Who do not hesitate, because it is definitely taking a toll on your mental health and your physical health. Just, if any chance that you can share it with somebody, just do it.
Not taking away the suffering that patients with dementia go through. Dementia itself is a huge thing. Respectfully, may I ask, when you said psychologically, financially, physically, there is a burden on caregivers, do caregivers also suffer any kind of mental health issues like burnout or depression?
Yes. So a lot of people have anxiety, depression, burnout, like, is very common. So one thing is, like, they don't, taking help for the caregiver is seen as sin for by themselves. Like, why am I feeling like that? Because it's just my father, it's just my mother. I should not be feeling like that. They took care of me. So most people do not take help because they feel like, what will people think of me? I'm not taking care of myself. I'm just doing bare minimum, but still, I am just making it a big thing. So that prevents them from taking help. So it is a big thing, first of all. So it's not easy. Nobody can just, be with a person with dementia in an easy way. So it's a big thing. So understanding and having a good knowledge about what dementia is, what can be expected in terms of memory, in terms of behavioral changes, that education is an important one. And the next thing is, like, definitely a lot of people, like, there are studies which says that, anxiety, depression, burnout is severe in caregivers and dementia patients, especially in dementia patients. But we need to just take somebody, and if we are taking somebody, we need to educate them also. Like, this could happen. My mother could sometimes accuse you of stealing things. So you should be, just try to do this. So educating everybody. So some family members also, if there is a function in the home or something, and the person with dementia is accusing somebody, like, they stole my things. So they will get offended and all. So there are a lot of things that we can do in a caregiver perspective. We can tell the family that, this thing is there. So my mother might call you somebody and tell that, this is happening with me. So this is because of her illness. Everybody should be aware of that, this is kind of illness. Sometimes she will not be very active, she will be very apathetic. Sometimes she will accuse you of stealing things of her own. Sometimes she will think that she is on the go. So sometimes she does not eat. Sometimes she just roam around during the night time. Sometimes she tells that this is not my home, I want to go to my home. So having an awareness about dementia to all the people in the family is very important, because one person is trying to do everything, taking all the knowledge and planning what to do better for the person will exhaust them for sure. So having knowledge to everybody, like everyone is aware of what this is, and if she needs some time, they can come and help. They can come in the front and, okay, I can take it. If something happens, I can handle it. So that is very important.
So whatever you mentioned, fear, anxiety, depression, we can only identify them as those conditions once they have settled in. But are there any kind of signs and symptoms that caregivers can notice within themselves that, okay, I am going into this territory, so let me take a step back? Are there any signs and symptoms that caregivers can look into themselves?
It can be different, like, subjective also. So in the first time, like, if, okay, initially somebody is diagnosed with dementia and, we are caring, we are taking information and everything. So we'll try to be very patient with the person with dementia. So we say that, okay, fine, I will be doing it. There is no break for the person, right? It's repeated. Sometimes they will not sleep at night. You have to wake up, be with them. Maybe they will be like, okay, let's go out for shopping. We have to console them. We have to persuade them to sit there and all those stuff. So it's complete. There is no break you are getting from this. So after a point, you will lost it. You will get angry. You know that you cannot get angry. You will get angry toward the person. At the same time, you will feel guilty of getting angry also. And there is a point, most of the people I have seen that they always carry a guilt that they're not doing enough. So it's like, first of all, they have to understand that there is limitation. And whatever they can do. But always, all the people have that guilt that, I am not doing enough. And sometimes they will lost it, they will get angry, and they will be like, accusing of something. Then again, they will get frustrated. And all this thing could be taken as a sign that, okay, I need some moment for myself. Maybe somebody can come in and I can just step back.
Once they've realized that, okay, this is where I have to take a step back, let's say, hypothetically, they get to take a step back, which in reality doesn't happen quite often.
Most of.
How can caregivers take care of themselves?
If I may ask you, what do you love to do when you are not feeling like yourself? What do you like to do for yourself?
I'm a caregiver, so I forgot what I would like to do long back.
Yes. So it's like, maybe at some time just sitting by yourself for 1 hour make a difference. So you don't know what other people. So if you ask me, I just like to just take a walk. When I feel like stressed or overwhelmed, I just try to take a walk. I'll just go out. And my grandmother is, she is having a vascular dementia. So it's just that sometimes she doesn't recognize you. Sometimes you go, she will be like, oh, why did you come? And she will be all agitated, angry towards you. So at that moment, I have to step back. So I will just go out, take a walk, talk to somebody, or see something to just lighten myself and then come back. So it can be anything that you feel like it will help you. So if you get 15 minutes and you just want to just put some lipstick on, that's also fine. Whatever you feel like, that could bring back some hope in you, some calmness in you, you can do it.
I'm usually I'm not at loss of words. But when you asked me, if you get a break, what would you like to do? I was at loss of words because I forgot what I like to do at a point in time. Yes, it's just not me. There are many people who are taking. I'm just not trying to tell that it is my story. No, there are many people across lakhs and millions of people who take care of others who have forgotten what they like to do. And if there is someone who's listening to that, who has forgotten what they like to do in the process of taking care of someone else, what is that you would like to tell them?
So first of all, dementia is not just a simple illness. It's not a normal aging also. Getting a good adequate knowledge about it makes a lot of difference. Like, if you feel like, your mother and father is having this repeated questions, they are just forgetting the routes to home or forgetting where the washroom is, and some mistakes are happening either here and there, just get them to a neurologist or a psychiatrist or whoever you are comfortable, physician or something, and then get the complete knowledge what is happening with this person. Like, okay, how it goes. Maybe after some days it can go more bad. So get full knowledge about what dementia is, like what are the symptoms, how it affects memory, and how long it stays like this, and is there any comeback for it, what will be the behavioral changes, how can we sleep disturbance, how can we manage them, all those things. Just acquire full knowledge and then take help. I know that we all know that we want to care for somebody we love, so there is always a guilt factor that we will not be doing enough. So limitation is there. You cannot do completely to cure that person. There is no cure for dementia. You can just manage the symptoms and you can make their daily living little more better. Okay, so all this, first of all, just acquire all the knowledge. Do not just listen to random people saying random things like, you go this, it will be happening this. So some people have incontinence and family will be coming like, just can you make it go? Can you just give them without that? So that might not be possible. So just take the full information and then plan. Okay, there will be a lot of things that will come. It will be a long-term process, so you will need a financial, full financial backup. So plan with the family, like, okay, this is going to happen, this is the condition, so I will be taking care of this person, or who want to take care of this person, or if I need some break, who will come and help me out. So all these things, planning this prior will make your life easier. And if you feel like, okay, I'm stepping into a burnout phase, just ask somebody who is involved in this treatment or caregiving plan and ask them to come in and take a step back. And last, I want to say that it's the difficult journey. It's not like, 1 day or 2 days. It's like sometimes it could take years. So you don't have to be strong all this time. You can sometimes get weak, stressed, cry, and sometimes panic also, but take help. Like, there will be people who are working in the same, area for long. So just take help from them. And always have a person in handy. Like, I just want to step out, come fill my gap. So also, do not carry that guilt that we have to do a lot of things. We did not, see it before. We did not see it coming. We cannot do that. So there are some risk factors, and we cannot always, control all of it.
Yeah.
But it will come. So do not take that guilt with you forever. Sometimes people carry it when the loved one is no more also. Like, I should have done that. No, there is limited thing for this. We still haven't done anything to regrow the neurons, right? So just be kind to yourself, take time for yourself, and acquire all the knowledge. Attend seminars. There will be like workshops, online caregiver supporter meetings, whoever, somebody, just attend that and acquire all the knowledge. And if you feel like somebody is a caregiver, talk to them. Because if the doctors or any other specialist could not give a solution for this, any other caregiver can do a solution. So they will be trial and error. So just take help and be kind to yourself.
That is what I want you to learn from this episode, that dementia is just not about memory loss. It is something that affects behaviors, relationships, finances, and rhythms of life of both the patient and the caregivers. It is just not important to be kind to the one who's suffering, but it's also equally important to be kind to yourself. If you are a caregiver, remember to take that break. Remember to heal yourself, because it cannot be prevented. So can your, but try to identify the symptoms early within yourself, and maybe one day you will, when you look back at what you have done, you will feel satisfied that in the process you have been able to hold yourself together. Thank you so much, Thashreefa, for doing this with me. And this is something that I wanted to do for a longer time, and I'm glad I found you as a resource person and as a guest. Thank you so much for doing this.
Thank you for having me. I loved it.
My pleasure.